how did you ensure when you got home, your housemates were going to be as safe as possible from any infectious diseases like COVID that you may have picked up on placement?
Because I was living in a shared house with the other people, and we're all working we're all working. So like, I don't think the only thing we really shared was the kitchen, or like me and another guy shared the bathroom, the shower, but like we just clean up after ourselves. And we were not so big on like keeping the social distance, to be honest with you. Like, we'd be 3 of us in the kitchen. The kitchen was quite small, so we really didn't mind.
Yeah. And I know that there was a rule when I did my first placement anyway, that for hospitals, you weren't allowed to travel in your uniform, and you had to put it in a pillowcase and then get home, put it on a wash. And yeah, those water bills went a bit higher for me, for sure. Was that Abby, were you raising your hand?
Yeah, I can just speak to, we had to change like before leaving the hospital, or like you had basically commute in different clothing. And then what I ended up doing is because we were wearing scrubs and they'd given me a couple scrub sets. And then on top of that, I was also allowed to wear my uniform. So I basically had enough outfits for 4 days. So I didn't have to do laundry every day. I would collect like the stuff I wore, put it in the corner in my laundry basket, and then I'd wash them on like a Thursday night. So if you have really nice PEs, they might give you extra clothes to wear, and then you don't have to do laundry as often.
And the scrubs are so comfy.
Yeah.
Hillary.
Yeah, I'm the same as Abby, really. I was given scrubs as well, because there actually was a few COVID patients were in my hospital at the time, just because it was a smaller hospital. But we were basically told to just like strip down everything, so completely change your clothes when you go in, like down to your shoes, and then come home. And I just went for a shower when I went home, just to clean everything. And then it's obviously, touch wood, worked, because I didn't get it myself. I didn't pass it on to anyone. So yeah, washing yourself works. Being clean.
It does, yeah. Even outside of COVID times, guys.
Keep up the
So my mum's in the vulnerable list. So when I was going out on placement, she decided to move downstairs into our spare bedroom, and she would just keep herself in a spare bedroom, and she had her own bathroom, and she'd only come out when I wasn't there, basically. And it was really quite nice and easy. I mean, she loved it, because she was like, oh, I get free time away from my kids. But yeah, so that's how we navigated it in my house. We just kind of made the one who's most vulnerable to have her own separate quarters, while the rest of us kind of just plotted around the house. But yeah, she loved it, really.
That sounds like it must have taken quite a lot of preparation.
Yeah, it was probably about 2 weeks before I was going on placement. So we had decided, okay, let's start moving her downstairs bit by bit, and because Mom's working from home, to move to office downstairs as well. But other than that, like, once it was all sorted, it was great. I mean, she was down there for about 6 weeks, I believe. But yeah, she absolutely loved it, to be honest.
Are there any other experiences? Yes, Ruth?
Mine's probably less positive. I caught it and spread it around my household. So.
Okay.
Yeah. There's no one in my household is vulnerable. There's 3 of us in the household. 2 of us tested positive. So, not I mean, I went through. It was a high. We did the risk assessment. It was a high vulnerable. We were out in the community, seeing people that were just at hospital in numbers. It was a high risk placement. I went through all the paperwork. I was a low risk candidate, but if you're on a high risk placement, you are at risk. That's just there's no way around that. So
absolutely,
you do the sort of thing Cheyenne did to mitigate. You need to. Everyone needs to make an assessment of themselves and their household and what sort of risk they're prepared to take. But that's going to be the truth of the reality of it's going to be the reality of working as well, isn't it?
I like brought what I do. I went to placement in like my street clothes, and then changed into them. Like my ward had a locker room for us, I changed there. And then at the end of the day, I put the clothes I wore into placement in a pillowcase, brought them home, and just like tossed that directly in the wash. Luckily, I had a few spare clothes, so I didn't have to do a wash every day.
Yeah.
But yeah, and then hop in the car. Yeah.
Yeah, I
Those
remember.
measures I remember taking.
Yeah, before starting placement, I do remember we had that induction in the, with the JR, and they said about the pillowcase, like you can't commute in your work clothes like we used to be able to do pre-COVID, and to put everything in a pillowcase at the end of the day, put it on, I think it was 60 or 90 wash. So yeah, there's definitely a lot of ways to reduce risk. Yeah.
But in regard to finding, like for our first placement before interrupted, like right before they interrupted them, I had my original placement was like 2 hours by train away from Oxford, so because we ended up, but I found accommodation on Spare Room and Facebook Marketplace, and yeah, there's a ton out there, and yeah, it's not too difficult to find housing, but you need to start searching early to find something that suits your needs, like within your price range, right kind of roommates.
Yeah,
it takes time.
Yeah, I didn't realize that you had to find alternative accommodation.
Yeah.
So I know for students, like UK residents, if we have to find alternative accommodation, we can have that money, we can get it back. But I don't believe it's the same for international students, is it? No.
So I do laundry 2 or 3 times a week, depending on how much load I have. But basically I wear a new uniform every day. And then as soon as my laundry baskets are right next to my door. They're not in my room. They're like, I'm at the door. I take everything off at the door. I leave everything at the door and I put them all in the laundry basket. And then my bathroom is right next to my entrance. So I just take a shower quickly and then I enter my room and I do everything that I want to do. I make sure that I'm wearing clothes on my way to placement. And then I change in placement. That's where I wear my uniform. And then at the end of the day, I take off my uniform, I put it in a plastic bag, and then I wear my actual clothes and I come back home. And that's where I dump my laundry kind of. And then I'm the type of person, I get cold, so I wear thermals. I also change the thermal that's under my uniform. Everything I wear when I'm working with patients, I take off when I'm going back home or leaving to go to the placement. And I think that way it just makes me really comfortable because I'm like, okay, at least the things that were on my clothes, if it's not inside my body, if it's on it, it's in the laundry. And I think that's something that I was not used to because I used to do laundry. I would wear every single piece in my wardrobe and then I'd go do laundry. And that would take 2 weeks. But now that I'm doing laundry 2 or 3 times a week, it does get a little bit hectic. But what I do is I put my laundry and I'm like, okay, now I have an hour. And so I cook. Or I go to the Waitrose that's right in front of where I live. And then I do my grocery shopping. And it's kind of use the laundry time to do things that you wouldn't usually do in your everyday life that you used to do before placement. It's okay, now that I have an hour, I'm gonna go and get my grocery, or I'm gonna go and watch a movie, or I'm gonna do whatever it is I need to do. But you're gonna do a lot of laundry and you're gonna spend a lot of money on laundry and you're gonna be this is useless, but it's not, I promise. I'm literally shocked that I haven't had COVID yet because my ward is here and then the COVID ward is it's not even a corridor, it's the door next to it is the COVID ward. And I see a lot of people going in and out and not wearing what they're supposed to wear sometimes, and it stresses me out. But you're not gonna get COVID if you're trying your best, and you're wearing your mask constantly, and you're washing your hands are going to get dry, and you're going to hate it because your hands are usually soft, but it's fine, everything's fine. Moisturize, that's my tip.
Thank you. Bryony.
I think something that was very useful for me, and I can't say if this is possible for everybody, but I'm really fortunate in the fact that I'm very close with my housemates. So what I did was I had a sit-down chat with them before I started placement. They were already aware of the fact I was on placement, where I was going, but I had a proper sit-down. We all sat in the same room, chat about what was going to happen. There was the possibility that I could bring something home, whether it was COVID, flu, norovirus, something infectious, that because you do always run that risk while being in a hospital setting, even before COVID, you know. So I had a proper sit down chat and really informed them and said, I will be doing lateral flow tests as the NHS guidelines are, twice a week. I'll be having a COVID test once every 2 weeks and an antibody test on top of that. And if I have any symptoms, I will not be going anywhere near you guys. I will be in my room. And I think really setting those boundaries and being like, if you guys are worried about it, you need to tell me, because you guys are not the one on placement, it's me. So I need to take the precautions to keep you guys safe. You guys shouldn't feel scared in your own home. And I think that was a really useful conversation to have, because it eased a lot of, I mean, they're not scared of me, but it eased a lot of fears, because COVID is scary things for people, and, you know, not being able to work or not being able to do courses or being ill is really scary for people. And I think really just talking about it to the people you live with is really beneficial. I personally as well do my washing every day in the week. So I take my uniform off at the end of the day. I put it in a pillowcase and I just literally throw it straight in on a 60 wash, so I know that it's gone and there's no trace of it left. That's just what eases my mind, and that's what I find best for me, and thankfully haven't had anything yet, so there we go.
Good. Well, I'm not surprised. I mean, you've both got incredible routines and also correct procedure. So following the rules, really. The all over the ward, like you said, Jana, wearing your mask correctly and using that pillowcase, and you know, the advice is not just there for fun, it's there because it works. And I'm really impressed, actually, Bryony, without trying to, I don't want to sound patronizing, but I'm impressed with the level of organization that you had in terms of your housemates, and that responsibility of sitting them down and saying, guys, like, these are the expectations. Because, you know, for 6 weeks, if somebody was at high risk that you were living with, you've put it out there, and actually university can help you find alternative accommodation for 6 weeks. And you laid everything down very honestly. And Jana, your level of organization, my goodness me, like, wow. Imogen, you raised your hand.
Yeah, so I'm currently in my family home, so I'm quite lucky that I do often get my washing done for me, which is very nice. But obviously then that does mean that somebody else is touching it. So I worked in a care home in the first lockdown. So we were all provided with a wash bag, which I'm sure you can probably get somewhere on internet, Amazon, that you just put it all in, similar to Bryony's pillowcase, and just chuck it in the wash. So I make sure I take my uniform in that to work every day, bring it home and chuck that straight into the wash, so none of my family members are having to touch my uniform. Wearing a mask into the building as well is really important. That can just be a fabric one. They're not strict on wearing your surgical mask into the building. Making sure you wear that, making sure you wear your PPE correctly. You will see tons of people leaving bays in the PPE. I know you spend most of your time donning PPE every day rather than seeing patients, but it has to be done. I know it's annoying. You see them, oh, you haven't got your frame, get this, and it takes forever, but it has to be done, and it's really important you do that. Also, making sure you do social distance even with your masks on is still really important. And at lunchtime, I don't know for everywhere, but in our canteen, the tables are 2 meters apart, but people still like to bring chairs round the table. And that doesn't really work when you're eating without your mask on. So just being really careful and just making sure you follow the rules, do social distance. And also because I'm in the emergency assessment unit, we don't have any control of who comes in with COVID, and we're unable to move them to a COVID ward. If you know someone has COVID, try and just say, oh, they have COVID, maybe we see them at the end of the day, just to prevent that extra risk of possibly seeing them and then going around everybody else. Just being really cautious and taking all the proper steps. And it is hard to think about it. There's so much to think about now, especially with PPE and all that, but just being extra careful and just following all of those rules because they're there for your safety. No matter how sometimes annoying it can be. Just following all the rules and being extra safe.
What PPE were you provided with for your setting? So various settings will be different. And how did you know how to correctly put it on and use it in the most effective way?
So in the mental health setting, we didn't really have a lot of COVID patients. We had a COVID ward, so if any of our patients were suspected COVID, they'd go straight to the COVID ward. Our PPE was mainly just a face mask. We got taught how to put them on the first day. We also had, we had our own clothing as well. So before, in most mental health settings, you can wear your own clothes. But when we got there, we were given a COVID uniform, which basically just a black t-shirt and some black cargo pants. So it was easier to wash. You were allowed to wear, what are they called? Those gloves. But it was up to you. It was completely your choice if you wanted to wear them or not. But we were given hand gel, so we could use that as well every time we came in touch with a patient.
Was there quite a lot of testing on the ward then?
Yeah. So we had it was like no visitors from outside. I think you're allowed a visitor once a week, but they had to meet you outside as well. So the ward was quite clean, and there was cleaners. They had up their cleaners, so they had quite a few throughout the day, cleaning up after patients. And then if anyone was ever suspected COVID, I mean, they tested weekly, patients and staff. So if you obviously went off and did your 10 days in isolation, and if it was a patient, they went straight to the COVID ward.
Wow, thank you. Eileen.
So my placement was a little bit different in that kind of the first few days of the week, we would have clients come in to the JR. So that was where I was placed, working with the MND team for motor neuron disease. And then the second half of the week, we would go out and do client visits at their own homes. So in regards to PPE, when we were doing clinic days, I would actually store my OT uniform in one of the main offices. So I'd come in different clothing, grab my uniform, change into it, wash my hands, all that stuff. And then when we met with clients, we had gloves, apron, surgical mask, and every time a client came in, we weren't touching, kind of trying to keep as much distance as we could. If we did need to do anything, we were immediately taking off gloves again and washing hand gel, wiping down the room, the chairs and things like that. And then when we were going on actual client visits, we would still be kitted up in the same way. But as soon as we entered the house, we would wash our hands, put on gloves, and then keep those gloves on until we left, remove the gloves, and then my PE, she had like a plastic bag for waste that we would then put them in, use hand gel, and then remove the rest of our items. Kind of thing.
Wow, really organized.
She was very organized.
That's really, it's reassuring to know the level of organization that goes into it. I think it's important to sort of just reassure new students, new starters, future students in the first years that you will be provided with what is safe and needed for your environment. I was based on a farm for my second placement, and the PPE was very different to when I was in complex medicine in the JR. So yeah, there is adequate PPE and there's enough, as long as you're using it correctly and following the right routine of what you do, what you put on first, whether it's a mask or an apron. And also don't be afraid of how many masks you do go through a day. Like I personally took my surgical mask off, everything off, before leaving the bay, and I changed it before seeing another patient, which, was my choice. Bryony.
I would say on top of that is wear whatever level PPE you feel comfortable with, and do voice your concerns if you are worried about seeing an infectious patient. I would say, because there are, I think most of the procedures are level 1 PPE for every patient, and level 2 if you're doing an aerosol generating procedure, if they're COVID positive with symptoms. But if you feel the need to wear an FFP3 mask, if you feel the need to wear an extra level of PPE, don't be afraid to do that. Just say to whoever you're working with, like, I don't feel comfortable in level 1. I would like to put on a higher level of PPE. And I feel like being open with what you're comfortable with and what would make you comfortable seeing that patient is going to benefit you and also the patient. Because if you're uncomfortable seeing the person you're working with, the patient's going to pick up on that and they're going to become uncomfortable, and you're not going to have a productive session. So it's better to just feel comfortable. And if that is wearing an FFP3 mask, then wear the FFP3 mask. Nobody's stopping you.
Yeah. Jana, thank you.
Also, I think people need to realize, so like some wards, because like for stroke specifically, they really try to like keep away like the COVID patients into coming into the stroke ward, because the people are so like at risk. Sometimes like your like the hospital will make sure, if you're working on a hospital, they will make sure that everything is very separated, and people who are high risk will not be doing things that might make them at risk. And like you do a fit test, and a fit test is basically they choose the perfect mask for your face that makes sure not a single particle can enter into your mask, and like they just make sure that you're comfortable with the way that you are wearing your PPE. And if it's something that is really scary, you can talk to your PE about it. It's not something that you can't talk about. Like one of the things I had to do was basically they asked me a couple questions, and I was like, I am low level, like I don't have asthma, but I have bad allergies that always end up going like down into my lungs rather than staying in my sinuses. And although that's not asthma and it's not considered something that might make me high risk or medium risk, I told them, I was like, I'm not comfortable seeing COVID patients because I'm not ready to get an allergy attack, and then my lungs are a bit weaker than they usually are, and then I catch COVID, and it's not something that I wanted to do. And so they're like, okay, you don't have to do it, because one of my choices was to work with COVID patients. I was like, I'm not doing that. That's not a thing I want to do. And I made it clear, like, I don't want to do it. And they respect your decision. It's not like they're going to be like, oh, but it's something that's easy. Everyone does it. Yeah, everyone does it, but I don't want to. And you can literally say that. It's completely fine. So, yeah.
Thank you. Yes, Imogen.
I just also like to add that all of our patients, if you want them to put a mask on when you're seeing them, you have every right to say, please, can you put on your mask? And if they refuse to put on their mask, then you are not obliged to see that patient. If they're downright refusing, it's your safety as well at the end of the day. And if they don't want to do that, then you can say, okay, I don't feel comfortable doing this session with you, and explaining to your PE or whoever's with you that, sorry, I don't feel comfortable seeing this patient if they're refusing to wear a mask, because you're in close proximity to them. And sometimes patients do like to hold your hand and stuff like that, and you can say, oh, I'm sorry, I'm not really comfortable with you touching me. You have every right to voice that to them without being rude, without you can have a nice way to say, I'm really sorry, but I don't feel comfortable working in this session with you if you're refusing to wear a mask. So don't feel like you can't say that to your patients in obviously a nice and respectful way.
Thank you, Imogen. That's a really, really good point. Jana.
Yeah, I also forgot. So I work in a place where it's not like the patient comes in and leave. They come in and they stay for sometimes weeks, sometimes months, depending on how severe they are, like their stroke is. And in my hospital, they do COVID tests for the patients twice a week. And so it's not just me who's being tested, it's also the patients. And so they always they make sure that everyone is constantly getting tested. And they do tell you, literally it was yesterday where a patient came in and they refused to get a COVID test, and it literally says on they give you a handout in the beginning of the day. It says has not done COVID swab yet. And that was one of the patients that my PE was like, oh, do you want to see them? And I was like, no. I was like, I don't want to. It's like a 90% chance that they're negative, but I don't care. I don't want to do that. And so I went and I saw another patient, and that's completely fine. And so yeah, it depends on how it is. So I feel like in Imogen's placement, it is a bit different because it is emergency unit. Anyone can come in and leave whenever they want. We don't do that on the hyperacute stroke unit. People come in and they stay there for a couple of days, if not weeks. And so they do get tested before they come in. They're not moved into the unit unless they've done a test. And even if they have done a test, they will continue doing tests until the patient leaves. And so that's something that I feel has made me really comfortable, because I know I don't have it because I'm doing the test. I know my coworkers don't have it because they're doing the test. And I know the patients don't have it because they're doing the tests. So it's kind of a lot more calming than not knowing what's going on with the patients. So